Hey everybody, it's Brian, physical therapist, and today I'm going to show you a sideline external rotation stretch for the shoulder, or the rotator cuff particularly. So this exercise is fairly easy and it's a nice starting point because there's no gravity and it can really ensure good form. So I'm going to show you the right side first, stretching the right side. So you're going to lay on the bed, my head, my pillow. Now I'm going to take just a little pillow and place it under my armpit. There's really poor blood supply to the rotator cuff, especially when your arm's at your side. So this just kind of helps, we call it, get out of the critical angle. So you're going to buddy up your legs, and the exercise is basically you're going to rotate your arm away from your body. But you're keeping this little pillow in here just to support, okay? You're not doing this, it's just your elbow is kind of locked like a door hinge at a right angle, and just make a fist, and then to start, you're just going to roll it up and roll it back down. So you want to just make sure your form is good, and there's no pain with just no weight and just gravity. And you can do a few of those, or if that's enough tension for you, do what you can tolerate. If it's 10, 20, whatever, do what you can, and then you switch to the other side. You can do the left, very simple. Put the towel back on the left side. Now if I want to check the left side, same deal, 90-degree angle. Got my pillow right in my armpit. And again, legs, it doesn't really matter, but whatever you're comfortable. Roll it up toward the wall, the ceiling, roll it back. Okay, so that's 1, 2. You do how many you can. Fatigues, pains, just stop. But it's just a nice, safe way to kind of make sure you're working the back of the rotator cuff, and this becomes a good exercise for rehabilitation as well. Hey everybody, Brian, physical therapist, and today I'm going to show you how to do the seated external rotation and sidelying for the shoulder with some weight. So now I have a dumbbell. So if I was able to tolerate just the movement without trouble, and it was fairly easy, and I wanted to test things a little bit, I go back to keeping my pillow here, and I can grab a dumbbell. And again, the rotator cuff muscles are fairly small, so it doesn't take a lot of weight. So you might want to start with even a soup can or a 2-pound weight. And you're going to basically do the same thing, but now with weight. So it's bring it up, bring it down as 1. And you're going to just see how many you can do to fatigue or pain. And you're going to feel that work in the back of the shoulder, back of the rotator cuff. And again, I'm not coming out, I'm just keeping it locked in on like a door hinge. And just keep track of how many you can do. So that would be testing the right, or exercising the right. Now if I want the left, all I do is I flip position, or roll over, but just so everybody can see. I've got the pillow under my left armpit, and I've got my weight here. So now for the left, just the opposite. I'm just rolling it up toward the ceiling and bringing it down. And I'm going to see how many I can do without pain or fatigue, and then stop. So up and down is always 1, and just keep track of that and see how many you can do. It's really easy. You can progress weights, but just really ensure that your form is good. And you can do those, that's something that doesn't have to be done too often, a couple times a week.